Hi, I'm really excited to be here today. My name is Allison Rosen, and I am a patient, community research, and policy advocate, and I also happen to work in cancer health disparities. So I'm going to be talking to you today about healthcare disparities in colorectal cancer, not only as a colorectal cancer survivor, but also as someone that works in the field. So I'm really excited to talk to you today. So what I just told you is sort of who I am. So I'm going to go a little bit more in depth. I know, I just had an amazing introduction, but I sort of want to give you a background as to who I am and why I care about this field. So in 2005, I started working in cancer research at Baylor College of Medicine. And for 12 years, I worked in cancer research, learning and soaking in all the information that I possibly could. During that time, I was diagnosed with colorectal cancer. At the age of 32 in 2012, I was diagnosed with stage 2 colorectal cancer. I want to say it was not expected. Obviously, I was having various symptoms that included the classic symptoms, but I had no idea at the time. I had change in bowel habits. I had blood in my stool. I had unexpected weight loss, and I was fatigued. Lo and behold, to me, I thought it was because of the Zumba that I was doing that I was exhausted and losing weight, but it turned out it was cancer. So during the time I was still working, but I went through my cancer treatment. I went through chemotherapy. I went through radiation. I have had 3 open surgeries. I have had septic shock and almost died. I've had long-term side effects that often aren't talked about, like osteoporosis, my loss of fertility, and kidney issues. I have kidney issues. So I think that what motivated me during my treatment, and let me say this, I'm now grateful. I'm 8 years cancer free and living life to the fullest and doing something that I'm passionate about. So having a background in cancer research, I realized that after I had survived cancer, I wanted to do something more. I wanted to be able to use my story to inspire people. I wanted to be able to use my story to educate people. I wanted really to work and make sure other people didn't have to go through what I went through. So the 2 pictures are one as me as a cancer patient. This was right after my first surgery. My dad took this picture. It was not approved, but I use it now really in the education that I do when I'm out in the community, as well as providers, because there's such a difference between that cancer patient who's me in 2005 to me in the other picture as now I'm a lead project coordinator in the Office of Outreach and Health Disparities at Baylor College of Medicine in the Daniel Duncan Comprehensive Cancer Center. And I'm grateful to be able to do the work that I do today after going through the journey that I did. So this conference is all about 3 different topics, essentially: health disparities, inequality, and equity. And I just told you who I am, and now I'm sort of going to go into sort of what I do on a regular basis in my everyday job. And then I'm going to go into different things that I've done as a patient in my job and that I can empower other patients to do, no matter if they work in the field or not. So I really liked this definition right here. The American Public Health Association says inequities are created when barriers prevent individuals and communities from assessing these conditions and reaching their full potential. Inequities differ from health disparities, which are differences in health status between people related to social and demographic factors such as race, gender, income, or geographic region. Health disparities are one way we can measure our progress towards achieving health equity. So it sort of sums up all 3 topics: health disparities, inequality, and equity, in one definition. So now I'm going to talk about, I could have talked about the broad colorectal cancer screening prevalence and disparities and whatnot, but I work in Houston, Texas, and Texas being one of the largest states in the US and one of the most diverse states, I really wanted to go into some of the issues that we face in the underserved and in the health disparities realm in my everyday job working within the community and providers. So I have some amazing data that was provided by the Texas Department of State Health Services. They have a Texas Cancer Registry, and they're amazing, and you ask them for certain information and they give it to you. And it really helps drive a lot of the research and the interventions that we do within our office. So here's a bunch of information. So first off, I want to talk about screening by race and ethnicity. And I know that a lot of people, experts in different institutions, probably have already talked about this or will be talking about this. So within Houston, we have a huge Hispanic Latino population. And they're at higher risk for developing colorectal cancer, along with African Americans. So you can see screening by race and ethnicity, there's a big issue. Only 42% of the Hispanic population has gotten screened. And this is data from 2012 to 16, but this is what people are looking at now to figure out what sort of interventions we should do. So looking at that, there's a lot of work that needs to be done in the Hispanic Latino population. A lot of our interventions in our office, I want to say all of our interventions in our office, have an aspect of focusing on the African American population and Hispanic Latino population. So everything is also done in Spanish because of this 42%. The goal is always going to be 80% through the National Colorectal Cancer Roundtable. Their goal is 80% in every community. So we really want to focus a lot on the Hispanic Latino population, like I said, the African American population and the Vietnamese population, because those are the populations in Texas that are more prevalent and have been, getting and being diagnosed and at later stages for colorectal cancer. Then we look at screening by age. And recently, the American Cancer Society lowered their recommended screening age for colorectal cancer to 45. So looking at this, you're not even taking into account that 45 age, but that 50 to 64 years, only 54% of them are getting screened in Texas. The 65 to 75 are listening, and that's 75%. So it shows that there needs to be a focus more on right when people are needing that colorectal cancer screening, talking to them and getting that done as soon as possible. We need to get that 54% up higher. Next, screening by education. So with education, all of our materials that we have in our office are at a 6th grade reading level due to what's shown here. Only 38% of people that have less than a high school degree are getting their screening. College graduates are at 71. So we really need to go to where these people are and educate them about the importance of screening. Now, I know a lot of the people within this population might have jobs that might not allow them to go to the doctor as often as they want. So this is why we go out in the community. We go out on the weekends. We go out to health fairs. We go to where they are so that we can give them that important information about colorectal cancer screening. So with that, here's a little bit more information about education. So in Texas, compared to the US, 17.2% have less than a high school education versus the 12.7% nationwide. 54.1% are high school graduates versus 56.4% nationwide. 28.7% are college graduates. So that number again shows you how important it is to reach the huge amount of people that are college graduates in Texas. So next we have screening by income level. And on this screen, again, I'm expanding on that and giving you a little bit more information on it. So people that make less than 25,000 are 45%, or only at 47% screening rate, versus people that make 50,000 and above are at 69%. So that means, as Texas being, a fourth of Texas counties have a median household income of 41% or less. What does that tell you? That tells you that we need, again, to go out to the community. We need to educate them. We need to tell them that no matter their income level, they still qualify for colorectal cancer screening. And there is free or very affordable colorectal cancer screening available to them. Affordable, accessible, and easy screening needs to be talked to these people that are in this income bracket. Lastly, we have insurance status, and insurance is a huge issue, and we work primarily in the Harris Health System. It's a safety net healthcare system, and 60% of the population that is treated at Harris Health is uninsured. Also, 60% of that population, going back to Health Disparities, is Hispanic or Latino. So this means that, showing this and showing the map, 31.4% of Texans less than 65 years old who are at or below 138% of the poverty level are uninsured. This is where our main focus is, and this is where the main focus of so many people should be. And a lot of times, all of what I just talked about, to tie it back, a lot of the uninsured population are the minority population, and are the ones that make the lower income, and also are the ones that have the lower income level. I think that we need to focus on, I mean, it's a no-brainer. We need to focus, and that's what we have, most of our programs are focused on every day that we're out in the community and working with the physicians in at Harris Health. So the two last lines on this slide are probably the most important thing that I can say out of this whole presentation, that I'm sure people have already said as far as colorectal cancer is concerned and the screening and the importance of it. The only way to offer necessary services at low or no cost. If there is a reason that people aren't getting screened, we need to figure out why. We need to identify that, and we need to fix it. And also, like I said earlier, these screenings need to be easily accessible. So if they come to the doctor, they need to be able to mail their test back in, which a lot of people do with the FIT test. But if they have to come back in the doctor for a screening, they're not going to do it. It's just not going to happen. So we've figured out various ways to make sure that when they get that screening test, they're able to mail it back in. And then there's reminders that the patient navigation team that we work with are probably some of the hardest workers and the most important workers that I'm sure every cancer center or every clinic has. They do the work that needs to be done. They call and remind these people. They call and make sure they have the screening test. They give them another one if they don't. And really they're driving the increase in screening rate. So, you know, I've talked about all these disparities, which I know everyone probably has already talked about colorectal. These are obvious disparities that exist, and there's amazing work being done for them. And I'm going to talk about some of the work that I've done as a survivor within my office, and some of the work that I've done as an advocate as well to help with that. I think I would be remiss if I didn't show this slide. And this is an amazing graphic that was created by the National Colorectal Cancer Roundtable, and it shows the pandemic effects. And we have all these health disparities, but COVID-19 is obviously worsened the health disparities that already exist for colorectal cancer, and people have an underlying fear, and there's an access issue to care. I was scared to go to the doctor, but now I have gone. Now I've posted pictures of me at the doctor with my mask. And I really am trying to advocate for people not to be afraid, that probably the hospital is the safest place you can go right now due to COVID. And access. I think there was that clinics were not seeing as many patients as they normally would. You know, the access to care wasn't necessarily there, but it is now, and it's increased. But if you look at these numbers, just from March to early June, 18,800 estimated missed or delayed diagnosis of colorectal cancer, and 1.7 million missed colonoscopies. We got a lot of work to do. And myself and so many others are trying to figure out the best ways to tackle this work so that people don't die from colorectal cancer. It's a personal mission of mine, as well as a mission of my office, to make sure that we tackle this number head on and do what we can. So efforts to promote screening in populations with low screening rates have to be our main focus. And that's what it has been, but we really, really, really need to do this and work with everybody and collaborate to make sure that this is a priority. So for those at higher risk, access to colonoscopy should be prioritized. So maybe a colonoscopy isn't the first line of defense. We don't do that for screening at Harris Health. It's a FIT test. We need to make sure that people understand all of the options for screening, and they do one. No screening. Any screening is better than no screening. I've heard that said numerous times, and I can only stress that even more. Any screening is better than no screening. So we also need to figure out unique ways to reach the underserved population, and things are being developed, and things are being shared, and things are being implemented right now. And I'm going to talk about a few of those, and I'm sure that other speakers have talked about what they're doing, and I urge everyone to get involved with the National Colorectal Cancer Roundtable if they're doing anything related to colorectal cancer, because unique ways are going to be shared, and people are going to be able to use those ways in their state, in their city, in their rural area, urban area, wherever they live. So with that being said, now I'm going to go into a little bit more of my work. My work as an advocate, but a little bit more work that I do within the office that I help to develop. So we know what we need to do. How do we do it? So when I started in my office as a colorectal cancer survivor, certain things were being done that were amazing. So I was trying to figure out what I could do to complement what was already being done. So I added on to already existing evidence-based interventions, and I helped to develop additional resources designed specifically to identify and explain specific barriers that certain populations face due to colorectal cancer screening. You can see this first flyer right here. So this was developed, this is it's called Quick Tips for Providing a Strong Colorectal Cancer Screening Recommendation for Different Populations. So I made one for African American populations, I made one for Hispanic Latino populations, and I made one for the Vietnamese Asian American populations. And each of these barriers to screening and motivators for future screening and what's to do next is specific for each of these populations. So I went in and I educated the providers in all of our clinics within the Harris Health System, and went through this one by one to talk to them about the specific population. So, a provider recommendation is the most important thing that you can do to increase the screening rate among any population. But knowing the barriers that face specific populations might help a provider say the right thing to a patient in order to get them to agree to get screened. So these targeted messages are so important, and delivery of these messages to a provider, for me as a survivor, open their eyes. So the first part of my presentation when I'm talking about a lot of this is the same picture that I showed you, me as a survivor. So why am I a young woman coming and talking to these people about colorectal cancer screening? I'm there because I've been through it, and I don't want anyone else to go. I'm using my story to open their eyes, to help them realize, okay, I really need to listen to this woman and see what she has to say and see if it can help me. And so the second piece of things, the second piece of the intervention that I developed was specific to the same communities that I just talked about, the Asian American, African American population, and the Hispanic Latino population. I use a lot of resources from the National Colorectal Cancer Roundtable. Through their market research and what they got, they have specific things that can be said to these populations that will help increase them to get screened for colorectal cancer, involving the family and talking about affordability and access and the importance are certain things that help with different populations. I think with the Vietnamese population, for example, some things that you can say to them, getting the matriarch, getting the person that's in charge of the family to agree to get screened. And that the Vietnamese population, they're very tight knit. A lot of times they live in the same neighborhood, if not the same, apartment complex. And if you get one person to do it, they're going to tell the next person, and that's going to trickle down to the rest of the population. If you get, within the Hispanic Latino population, if you tell them that there's easy, accessible, affordable, like I was talking about earlier, a screening option for colorectal cancer, and you have all the materials in Spanish too. Language is always going to be a barrier. So if you have someone that's telling them about this in Spanish, then they're likely to do it because they might not understand you otherwise. So these are two different things, like communication tips and ways better to communicate about the importance of screening. Like I said, on top of our already existing evidence-based intervention, which includes, patient reminders, patient education videos, patient education materials, a colorectal cancer or a cancer screening wheel, all of those are things that we use. This is something added. You can't always have a survivor doing this. Obviously, I'm unique in the fact that I work in health disparities, but getting a survivor story, even if you can't, talk about the experience because you haven't been through it, get a picture of a survivor, get quotes from survivors, use real life examples to help educate providers and their staff and the community about the importance of screening. So another thing that I think is important, and I've attended conferences and I've heard people talk about it, and I'm actually doing it, and I'm really excited about doing it, is what do we need to empower future providers? How do we get providers that look like, talk like, and have experienced, like all the populations that are at higher risk for colorectal cancer. So that means empowering, the Hispanic Latino population. That means empowering the Asian American population. That means empowering the African American population. That means also empowering, even though in Texas, the Native American population doesn't necessarily, they're another that has a high disparity for colorectal cancer. So getting them involved. So, I think that there I am, this little person. I educate and tell my story and talk about colorectal cancer and the importance of colorectal cancer with medical students at Baylor. I also talk to pharmacy students at the University of Houston. I also tell my story to community health workers. Also, as a part of outside of work, I mentor children in underprivileged and underserved areas, starting in elementary school, about the importance of education. So I was a survivor at that time, and they knew I was a survivor. And I told them, not only me, a group of alumni from Texas A&M was empowering these kids to get an education, to further their education, to realize that they were enough. They could excel in life, and they could do anything in life if they put hard work into it. So when I told them about my cancer story, and I hope it empowers them to maybe be the that exist within our society throughout the world. So, I think the importance of using the patient story and the patient voice is so important in education, no matter what level. Like I said, I started with mentoring kids in elementary school. I talk to kids in high school. We have the DeBakey High School here for health professions here in Houston that I talk to. And then, it's taking these people in medical school, in pharmacy school, people that are studying public health. It's starting there, but it's also starting before that. And, I really want to help start educational programs as early as possible, empowering youth to become the future providers. Because like I said, people are going to get screening, and they're going to listen to people that look like them, and come from where they come from. So another thing that I have on here that I've heard talk about, which I'm proud to be a mentor, is having mentors of similar age, sex, ethnicity, sexual orientation, and this is vital to success in anywhere. I couldn't have gotten to where I am now without a mentor, and I think a lot of people might not think that they can do what I do or what other people do, because they don't see people that look like them. You have the you have the different populations, women in science. There's a huge empowerment. I get pushed to empower women to excel in science and medicine. And I think that it's initiatives like that everybody needs a mentor, no matter what sort of level you are in education. So something else I want to talk to you about are awareness initiatives that can engage everybody. So we really want to, like I said, go where the people are, be where the people are. We want to do as much as we can to spread awareness about colorectal cancer. So I started an awareness initiative locally in Houston, and I've engaged all ages, all sexes, all ethnicities, and all walks of life to help me promote colorectal cancer awareness. You can see in this picture, we have a 16-year-old child holding our proclamation for colorectal cancer awareness, who's a colorectal cancer survivor. We have our mayor, who is African American. We have a veteran who is a colorectal cancer survivor. We have providers from medicine, GI, and oncology that not only speak English, but speak Spanish and multiple other languages. So I really, when I'm doing my initiatives locally in Houston, I don't want all the survivors to look like me. I want everyone to participate, but I really want the awareness for colorectal cancer to look like the disparity that actually exists. So this picture is witness to the importance of engaging everyone within the community and making them realize that their voice and their story matters. Like I said, I work in the arena, but you don't have to work in the arena to tell your story. You don't have to work in the arena to educate people. So I have it all in caps because this is so important. Awareness is the key to prevention. Awareness initiatives can be free. A lot of what I've done, this included having a press conference with our mayor, getting a proclamation. I'll talk about the next initiative that I worked on. It was free. It just cost time and energy. And if you don't have time and energy to do that in your office, reach out to the advocates, reach out to the patients, reach out to the survivors, reach out to the caregivers. They want to do it. I can guarantee you that. I've had so many people reach out to me asking how I did what I did and if they can do the same. So I'm trying to empower people to do what they want, engage in their cancer center, their clinic, their safety net healthcare system, wherever they are treated, volunteer to use their story to help others just like I have. So if we all work together to combat health disparities and help increase the colorectal rate, then we can all be successful. Not one person can do it alone. I volunteer with so many different advocacy organizations that to do different things for different ones. They're all important. And if we all work together, which we all are working together on this, on colorectal cancer awareness, then we can be more successful. We can help increase that screening rate and we can save lives. It's a simple fact, and I'm proud to be a part of it. So to promote awareness, nothing is off limits. And when I say nothing is off limits, you can see from this picture. You have to be creative, innovative, and very dedicated. And so one of the examples is this picture. So, I know that people maybe have or have not seen a giant inflatable colon, but this is what a 20-foot giant inflatable colon looks like. We do a giant colon tour within our Houston area, taking it all over to areas not only in the Texas Medical Center, but to parks where specific populations that are at higher risk for developing colorectal cancer exist. We have it out there. We have the education materials so that we can have people come and ask us questions. We're trying to get to even bigger events to find, to reach as many people as possible. But it's like I said, it's time, it's energy. The person in the center is in a poop emoji costume. Now you might laugh about that, but that poop emoji costume is everywhere. On the Apple iPhone, there's a poop emoji, icon, a little thing that people can use to send to people. It's everywhere. Kids know what the poop emoji is. So you use that costume and dress up as a poop emoji and talk to kids as well as adults. You're going to educate them about colorectal cancer. You're going to laugh about it at the same time. Nothing is off limits. I can't tell you how many times I put this costume on and put some crazy poop emoji glasses on or pins on, all for the name of awareness, all for the name of educating people about the disease. So like I said, nothing's off limits. So you got to be, as creative as possible. We had, a pop the polyp game that sort of had the kids popping the polyp. And while they were doing that, you had the parents over at our table getting educational materials. So you got to figure out ways to engage this population at health fairs where they're going to go and get maybe, free food, free screening, free blood pressure checks, free heart checks. So here's another example. This is the third year that I started this Light the Night Blue campaign, again in Houston. And it came out of an initiative that is being done by the Colorectal Cancer Coalition, the Colon Cancer Coalition. They're based out of Minnesota, and they light Minnesota blue every year. So I volunteer with them. I'm the event director for their Get Your Rear and Gear Houston race. And I saw that what they were doing in Minnesota, and I was like, well, there's no reason we can't do that in Houston. And so slowly but surely, by myself, initially, I think 5 buildings, including our a lot of our institutions in the medical center, to turn blue. And then the next year, I got 30. And besides getting 30, I engaged our American Cancer Society partners with helping me. Their mission is to end cancer and to educate about cancer, just like ours is. So we have that shared mission. So myself and all the people that I work with at American Cancer Society last year got 50 plus buildings, landmarks, businesses to agree to turn blue. So here are some of the pictures. We have bridges over our freeway. We have, Baylor where I work. We have some buildings downtown. We have buildings throughout the whole city. So I didn't want it to be just within the medical center. Like I said, we want to go to where the buildings are. And if they aren't able to if they don't have LED lights to turn blue, they can dress in blue. A business can dress in blue. Someone can wear blue and post a picture. There's a hashtag called Blue for CRC, and that really is cool. Besides these buildings, we wanted people to sort of ask why the buildings were blue. So, why they're blue isn't going to do anything unless you educate about it. So we went on TV, we went on radio, We went on different radio stations, not only the mainstream radio stations. We went ones that were targeted at the Hispanic Latino population to talk about this. And we talked about, if you see a blue building, take a picture with it and post it on social media. So you can light the buildings a color, but unless you have the media outreach, and we had a press conference like I showed in the previous picture with our mayor urging people to get screened for colorectal cancer. And because African Americans are at higher risk, he talked about that from his perspective, since he is African American. So it's a multi-pronged approach, but all of this, including this campaign right here, were free. Like I said, they took time and energy, and it won an award for what it was doing. We engaged not only the community, but the providers and the advocates and the survivors and businesses and institutions in this, and everyone wanted to be a part of it once they saw one person was a part of it. So with that, I'm going to end my talk and say thank you so much. I think that this picture of every color holding hands sums up health disparities really well. We all need to work together to make the word health disparities not exist. We need to make sure that everyone has access to colorectal cancer screening, just like I had access. I want lives to be saved, and I want people to feel empowered that they can talk to their doctor and ask their doctor the questions they need to about getting the screening that should be available to them. So again, thank you so much for having me. And if you have any questions, here's my personal email address, and please follow me on Twitter. I'm very active, and I post things about colorectal cancer and advocacy all the time. And if you want to get more involved, I said earlier, I'm involved with the Colorectal Cancer Alliance, their Never Too Young Advisory Board. I'm involved with the Colon Cancer Coalition, Get Your Rear in Your Race. I'm a Fight CRC ambassador. I work with ACS CAN and American Cancer Society. I also work with the National Coalition for Cancer Survivorship. I mean, I could go on with the organizations that I work with. I also work with SWOG on clinical trial diversity. And I want you to be able to do what I'm doing, maybe not at the level that I'm doing. I'm a little bit crazy, I'm not gonna lie, but I wanna empower you as not only a provider, but someone that's obviously here interested in health disparities, or as a survivor or patient or advocate that's here because you've been affected by cancer, to get more involved. It doesn't even have to be necessarily colorectal cancer. It could be any cancer, because I work with all of them. But I really focus a lot on colorectal cancer because I survived it, and I want everyone else to be able not to survive it. I want it to be plain and simple. That's my message. So thanks again, and please feel free to reach out to me.